Hello, I'm Dr. Marcia Nelson. I'm the Chief Medical Officer at Enloe Medical Center and also a practicing family physician. Today we're going to be talking about COVID-19 testing, what sort of tests are available, and how you should interpret them. What do they mean for you? We've been asked at Enloe what sort of tests are available for COVID-19. There's basically two different types of tests. There's a virus test, that's also called a PCR, and there's an antibody test or serology test. Let's start with the one that I think is a little easier. It's the PCR test. It's the one that when people talk about it, it's the swab that gets put up a person's nose. Not very comfortable, but very effective. The PCR test can give either a positive or a negative result. A positive result is a positive result. You have COVID-19. So you can feel very assured with that result that it's correct and we know what's going on with that. If you get a negative viral test, the nasal swab test, you probably don't have COVID-19. The reason I say probably is that it might be too early in the infection to pick it up. So sometimes a doctor will use their clinical judgment and they'll retest after 24 hours. But so far, the negative tests have really stood the test of time, and a negative so far here has been a negative result. So now going on to the more complicated result, and that's with the serology test. The serology test or an antibody test will also give you a positive or a negative result. These tests are done by getting a little prick of blood and looking for proteins called antibodies that can say whether or not a person has ever been exposed to a type of infection in their body. Just like with the PCR swab tests, the serology test, the antibody tests, will give you a positive and a negative result. Let's talk about the positive results first. A positive result may mean that yes, you had COVID-19 at some point. But, and this is the confusing, complicated part, is it also may mean that you had been infected at some point with one of COVID-19's cousins, a common cold virus, for example, or another virus called cytomegalovirus. So a positive test on serology for COVID-19 may or may not mean that you ever had COVID-19. A negative test for the antibody is also a little bit complex because it takes time for our bodies to mount a response to any sort of an infection, be it a common cold or the flu, things like that. And if a person has a negative antibody test, what it may mean is that you just don't have enough antibodies yet to say that you had the infection. So you could have had the infection, we just don't know yet. So it's all very nuanced and complicated. And the thing to remember, though, is that regardless of whether you've had a positive test for antibodies or a negative test for antibodies, you still have to maintain social distancing right now. You still need to wear a mask when you're out and about. You still need to consider that you could still infect other people and not be exposing loved ones, friends who are susceptible and in high-risk groups. So a lot of people want to know, how quickly will I get my results back? The serology tests, which are the finger prick blood tests, those results are available within minutes. The PCR virus tests, those results are available within 24 hours when a person comes to Enloe. So some of you have asked, what are we testing and who are we testing? So the answer to that is that Enloe is a level 2 trauma center responsible for taking care of several counties' patients who come in for traumas and taking care of our hospitalized patients, our surgical patients. And what we are doing here at Enloe is we are prioritizing our testing for those who are coming to the hospital for care. What that means is that patients who come to the emergency department concerned that they have respiratory illnesses that may be COVID, those patients are screened very specifically and very carefully. And if needed, they'll get a COVID test, the PCR test, the one that's a nasal swab that we were talking about. Also, recognizing that patients who are having surgery are particularly vulnerable, we're also doing screening for symptoms for patients who are coming to Enloe to have surgery. We're doing that multiple times before they even arrive. And then for patients who are having surgery who will be spending the night, they're actually getting the COVID-19 nasal swab PCR test So what happens if you found out that, yes, you do have COVID-19? That nasal swab test was positive and you have COVID-19 and you're at home, you're doing your self-quarantine. The whole concept of self-quarantine can open a lot of questions. It's like, where do I go? How do I do it? And so the best place to go is Butte County Public Health, the website for the Centers for Disease Control. There's a lot of instructions about what does it mean to self-quarantine. What can you do? What can't you do? And for how long should you be doing that? But let's say it's a couple days down the road and you just aren't feeling well. You feel like you're getting worse. It's harder to breathe, shortness of breath, and you just don't think you're getting better. You think you're getting worse. Then you should definitely call your healthcare provider and get guidance from that person, and even come back to the emergency room to be reassessed. We all know that COVID-19 information is changing very quickly, and that applies also to testing. Right now, with the virus test, that nasal swab test, that's the way we do it right now, but that's the way we do it right now. We're also looking at ways to be able to do the test by just swabbing the outermost part of the nose or the back of the throat. And there's other tests that are being developed now that will be easier than that nasal swab. So it's something that changes all the time, and we will try to keep links up for you so that you know what's the latest in testing. Thank you for joining me today. And above all, thank you for being engaged in your health, your community's health, for keeping us all safe. This is a very quickly changing subject. Every day, every hour, it seems like there's something new. So please check back. We'll be giving you the updates you're asking for. Stay well.